Welcome back to MediNotes for Medicos, and the topic that we're going to deal today is about amiodarone. Now, amiodarone is a very important topic that we all need to know. Why? Because it is an antiarrhythmic drug. Now, the overview is we'll be learning about Vaughan-Williams class, the introduction, pharmacokinetics, mechanism of action, the indications, drug dosage, adverse effect, and the contraindications. Firstly, we'll go with the Vaughan-Williams class. The reason why we need to know about the Vaughan-Williams class is because we have in books like class 1, class 2, class 3, class 4 drugs and all, but we don't know what is it. So when it is said as class 1 antiarrhythmic drugs, that means it involves something to do with the channel of sodium blocking. When it goes to class 2, it's beta blockers. Class 3, potassium channel blockers, and class 4 is the calcium channel blockers. With this information, we'll proceed to our class. For the introduction, I have already said that it is an antiarrhythmic drug and it is a class 3 drug. Class 3, I have already said, according to Vaughan-Williams classification, class 3 drugs means it has potassium channel blockers. Now, it is the longest antiarrhythmic drug with a half-life of around how many weeks? 3 to 7 weeks. And it is the widest antiarrhythmic. It has a widest antiarrhythmic spectrum. Why? Because it possesses all the properties of class 1, 2, 3 and 4 drugs. Now, what is 1, 2, 3 and 4? That means it possesses sodium channel blockers, beta blockers, calcium channel blockers, and also potassium channel blockers. Now, this is basically a potassium channel blocker. Now we go to the pharmacokinetics. When it goes to the pharmacokinetics, the route of the administration could either be in form of IV or in oral. And as I have said in the previous slide itself, that it has a very long life. So it having a long life, the doses should be under observation constantly. When we talk about the conversion from uh, IV to when we convert it from oral to IV, it's almost around 50 percentage dosage. So we go to the mechanism of the action now. I have already said that this specific drug called amiodarone has all four classes drugs property in it. So when this amiodarone is taken in, it causes a prolongation of the repolarization phase. And if there is a prolongation in the repolarization phase, it causes a decrease in the calcium permeability, increases the potassium permeability. It also works in sodium channel blockers and beta blockers. Why? Because it consists all the properties of class 1, 2, 3 and 4 antiarrhythmic drugs. Now, because of this action, it controls all the arrhythmias. Now we go to the indications. Indications means in which cases you can give amiodarone medication to the patient. When the patient is suffering from refractive ventricular tachycardia, especially when there is an underlying acute ischemia, when there is atrial fibrillation in the sense there is a normal sinus rhythm disturbances, and in the prophylaxis of all arrhythmias except torsade de pointes. Why? Because in torsade de pointes, it doesn't it doesn't causes torsade de pointes over here. So we can't give them for the prophylaxis of torsade de pointes. Then for the myocardial infarction and ventricular fibrillation. And we go to the next, that is the drug dosage. If a patient is suffering from supraventricular arrhythmia, firstly we will give them a loading dose. What is the loading dose over here is, it is given in the form of IV, that is 300 mg, that too in the time gap of 1 hour. And then we'll follow up the patient with 10 to 50 mg per hour in 24 hours. And then we'll give them oral dosage of 100 mg to 200 mg, that is in a dose of daily dose. Then we'll go for the ventricular arrhythmia. When we go to ventricular arrhythmia, we need to know that in supraventricular arrhythmia, firstly we give the loading dose as IV, but in supraventricular we give them as IV, and for ventricular we give them as oral. So in an oral dose, we can give it as 800 to 1600 mg daily until the therapeutic responses uh, accomplished, and it is given in divided doses. We won't give them at one stretch in 800 mg. And then we'll follow up them with the maintenance doses. Once once ventricular arrhythmia is like, if the if we feel, the doctor like us would feel that okay, we have attained the therapeutic response, we'll give them a maintenance dose, that is to prevent the reoccurrence of ventricular arrhythmia, that is 600 to 800 mg daily for 1 month post therapeutic post the therapeutic response. Then we will follow them up with a lower maintenance dose, that is to 400 mg daily. Now, what are the adverse effects that this drug can cause? It would cause peripheral neuropathy, myocardial depression, pulmonary fibrosis, hepatotoxicity, corneal microdeposits of or optic neuropathy, photosensitivity, blue-gray discoloration. This is a very rare adverse effect that is seen. Then hypothyroidism. Why? Because amiodarone, it contains I2 in the proportion of around 37.5 percentage. When in hypothyroidism, what happens is, because amiodarone, it consists of I2, it prevents the enzyme 5-D iodinase from converting the T4 to T3. And the drug that is similar to amiodarone, that is dronedarone, it does not consist of iodine. Now, and we can also it would also cause on chronic usage of amiodarone, it would cause arrhythmias in different ways. Why? Because it has all the properties, I said all the properties like class 1, class 2, class 3, class 4 properties, which has sodium channel blocking, beta blocking, as well as calcium channel blocking, apart from its own potassium blocking capacity. So on chronic usage, it would cause arrhythmias. The next is the contraindications. Now, what are the contraindications? It might cause cardiogenic shock. It shouldn't be given in cardiogenic shock. It shouldn't be given in cardiogenic shock. In severe sinus node dysfunction causing marked sinus bradycardia, it shouldn't be given in that. In second or third degree arterioventricular blockage, in episodes of bradycardia that leads to syncope, except when used in conjunction with pacemaker. In these cases, this drug shouldn't be given to the patients. So that was the video. If you like this video, don't forget to like, share and subscribe to the channel. We'll come with more educational videos. Till then, stay tuned and happy learning. Bye.